Hello, my name is Olivia Staples. I'm a nursing student at the University of South Alabama, and today I'll be performing the central line dressing change. So she's going to scan the room. Upon entering the room, I'm going to perform hand hygiene. I'm going to verify the order as well as hospital policy. I'm going to identify my patient using two identifiers. So his name is Jaguar Jones, date of birth 8/25/1963, 8/25/1963. I'm going to assess his allergies, and I notice he's allergic to penicillin and penicillin. Now I'm going to gather all my equipment, make sure it's all here. I'm going to explain the procedure to the patient and provide privacy. And now I'm going to assess and palpate through the dressing. And while doing this, I'm assessing whether a wound culture would be obtained if that would be indicated if there was infection such as drainage, inflammation, or odor. And so now I'm going to make sure that the table is at waist level and making sure it is on the side of the central line. And I am going to then move the trash can, make sure it is positioned correctly, perform hand hygiene. And I'm going to open my kit. And I'm going to open this away. I'm going to put on my mask and put on my goggles, and then I would assist my patient and put his mask on. I'm actually going to lower my mask for the sake of the video, and then I'm going to apply my gloves. So now I'm going to remove the tegaderm. I'm going to stabilize the catheter and pull towards the wound, towards the site. And I'm going to remove the bio patch, discard of that in my gloves. And now I would also be assessing I would be assessing the catheter, the insertion site, and the surrounding skin, as well as any signs and symptoms of complications. And if a culture were to be obtained, I would do that now. Now I'm going to perform hand hygiene and open my kit, being conscious of the 1-inch border. Now I'm going to apply my sterile gloves. Again, being aware of the 1-inch border. I'm going to fix them. All right, so they're on, and I'm going to organize my sterile field, making sure nothing passes the 1-inch border. I'm going to first clean, and I'm going to be cleaning in rainbow motions, working from the site outwards. So I'm going to do this, making sure I do not go over the same area twice. Now I'm going to discard that above my waist as well. I'm going to use my ChloraPrep. And I'm going to activate it with the butterfly wings, and I'm going to begin vigorously cleaning the in vertical motions and horizontal motions. I'm going to be getting the catheter as well, making sure I don't pass the line. So like I said, I'm going to do this for about 30 seconds. After that, I'm going to discard that. I'm going to make sure that it dries completely. And now that this hand is contaminated, I'm going to get my bio patch. I'm going to apply this, making sure I do not contaminate it with my other hand, making sure that the blue side is up. So now that that is on, I'm going to get my Tegaderm I'm going to make sure my gloves do not touch the sterile part. Like this. I'm going to apply this, making sure my bio patch is in the middle. I'm going to make sure it's completely down, and I'm going to remove the sticky part. Making sure all the edges. I'm going to just set this to the side from my label. Now I'm going to remove my gloves, using glove to glove, skin to skin contact. Now I'm going to make the label, and but before that, I'm going to be assessing. I'm going to remove my gloves and my goggles. Before that, I'm going to remove my mask, and my goggles, and my gloves. And then I would also remove the patient's mask as well. Now I'm going to begin labeling. Sorry about that. So I'm going to begin labeling, and I would put the my initials as well as the date and the time, and I would be sure to put this on the tegaderm, being sure not to cover the insertion site. So right there. And now I'm going to raise the bed to working height. Lower the bed to the lowest level. Make sure the side rails are raised. Make sure the call light's in reach and that the patient is comfortable. I'm going to discard all my equipment. After that, I'm going to perform hand hygiene and begin documenting. I'm going to document the appearance, the drainage, the amount, the characteristics of the wound culture was obtained, the type of cleanser used, the dressing that was applied, the patient's tolerance, as well as the date, time, and my signature. Thank you.